Okay, picture this for a second. Your dog, maybe your cat, suddenly just can't breathe right or collapses or, is clearly in a lot of pain. It's terrifying, right? But in those moments, there's actually a system, kind of like in a human ER, for figuring out who needs help, like right now. It's called triage.
Exactly, and that system, that whole process is what we're getting into today.
Hmm.
We're using this really detailed list as our guide. It's basically a rundown of potential triage situations you'd see in a small animal emergency clinic. Think of it like getting a bit of a backstage pass. You get to see how the veterinary teams make those super quick decisions about who needs care most urgently.
Right. We've got this source, list of potential triage cases, and it is packed. It shows the huge range of emergencies that can happen. Our goal isn't to turn you into a vet tech overnight, obviously, but more to give you a feel for the sheer variety of medical crises pets can face and the logic behind that initial sorting process. So let's start there. Triage. What's the main idea? What are they trying to achieve?
Well, fundamentally, it's all about speed and assessment. Making a quick judgment call on how severe the situation is for each animal that comes through the door. You need to figure out who is in the most danger, so you can use your resources, the staff, the equipment, everything most effectively. It's about focusing on the life-threatening stuff first.
Makes total sense.
Okay.
Okay, so this list breaks things down into categories. Let's jump into the most serious one first, the red category.
Right.
What lands a pet there?
Red means immediate danger, like intervention is needed now or the animal might not make it. The list points to a few major areas. First up is respiratory distress. And we're not just talking about panting hard after chasing a ball. This is serious difficulty breathing. It could be something blocking the upper airway.
Like choking.
Yeah, or maybe laryngeal paralysis where the voice box doesn't open properly, or even a collapsing trachea common in some small breeds. It's like trying to breathe through a pinched straw. Then you've got lower airway issues, think severe cat asthma, or problems in the lungs themselves, like really bad pneumonia or fluid buildup, pulmonary edema, where the lungs are essentially filling with fluid, or even blood clots in the lungs. And there's also pleural space disease. That's where air or fluid gets trapped around the lungs, squeezing them so they can't expand.
So they can inflate properly.
Exactly. And finally, just severe lack of oxygen, hypoxia, or too much carbon dioxide, hypercapnia. Basically, respiratory failure. It's amazing how many ways breathing can go critically wrong.
Yeah, no kidding. That's a lot, just under-breathing problems.
Yeah.
What else puts a pet straight into that red zone?
Severe trauma, that's another big one. Hit by a car, a serious fall, penetrating wounds like deep bites, or unfortunately even gunshots. These often mean massive internal injuries, organ damage, and a really high immediate risk of shock.
And shock itself is on the list as red, right? But what is shock exactly? It's not just being scared, obviously.
No, definitely not. Shock is basically a failure of circulation. The body's tissues and organs aren't getting enough oxygen and nutrients because blood flow is compromised. It's like the delivery system breaks down. The list breaks it down. Hypovolemic shock is from losing a lot of blood or fluids, like a severe dehydration.
Okay.
Cardiogenic shock is when the heart itself isn't pumping effectively. Septic shock is from a massive, overwhelming infection taking over.
Right.
And anaphylactic shock, that's a huge sudden allergic reaction. Whatever the cause, shock progresses fast and needs aggressive treatment immediately, or organs start to fail.
Okay, so red is clearly the absolute critical life-on-the-line stuff. Let's move down a level to yellow. What does that look like? Still serious, but maybe not quite as immediately dire?
Exactly. Yellow means the pet needs help urgently, definitely. But they aren't crashing right this second. The list mentions things like mild dyspnea, so difficulty breathing, but not the desperate gasping you see in red. They might be breathing faster or putting more effort in, but they're still managing to get enough oxygen for the moment.
It's a serious warning sign, though. Needs checking out quickly before it gets worse.
Got it. What else falls into yellow?
Urinary obstruction is a really common and important one, particularly for male cats. If they can't pee, toxins build up fast. It's incredibly painful. It can cause kidney failure. It's bad news if not fixed promptly, like a blocked pipe causing a nasty backup.
Yeah.
Then seizures. Now, a single short seizure might not be red, but the list highlights cluster seizures, that's several happening close together, or seizures caused by toxins. Those need urgent attention to stop them potentially escalating into status epilepticus, which is non-stop seizing, and that would definitely be red.
Right, okay. And I see acute abdomen listed under yellow, too. Sounds painful. What kind of things does that cover? It is painful. Acute abdomen just means sudden, severe belly pain. The big one the list calls out here is GDV, gastric dilatation volvulus. bloat, especially in those bigger, deep-chested dogs.
I've heard of that. It's really dangerous, isn't it?
Extremely. The stomach fills with gas and then twists on itself, cutting off its own blood supply. Think of like twisting a balloon closed. It's a surgical emergency, needs fixing fast, within hours, or it can be fatal.
Wow. Okay, so yellow is definitely serious, needs quick action, but maybe there's a slightly longer window than red. What about green? The least urgent.
Exactly. Green category patients have issues that aren't immediately threatening their life. They can usually wait a bit while the red and yellow cases are stabilized. Examples from the list would be things like minor wounds, superficial cuts, scrapes, not bleeding heavily, or mild vomiting. Maybe they threw up once or twice, but otherwise seem bright and okay, no other major signs.
Okay, so the vet team is constantly juggling these, making these snap judgments based on what they see initially. That sounds incredibly stressful.
It really is. And, looking through the list, a few areas really jump out because of the sheer variety, like toxicities.
Oh, yeah.
It's kind of wild when you think about it, all the things pets can get into. Chocolate, xylitol sweetener, antifreeze, human medications. Then there are plants, snake bites, even reactions to some flea and tick stuff.
Oh.
It just shows how many hidden dangers there can be, even around the house. Stuff you might not even think twice about leaving out.
That's a really good point. Definitely an aha moment.
Yeah.
What else stood out to you from the list?
Well, the range of neurological emergencies is pretty broad, too. We mentioned seizures, but it also covers things causing paralysis, like IVDD, that's like a slip disc in their back, or
Yeah.
something called FCE, which is sort of like a stroke affecting the spinal cord. It highlights how complex the nervous system is.
Yeah.
And then you've got endocrine emergencies, things like DKA, diabetic ketoacidosis, a severe complication of diabetes, or Addisonian crisis, where the adrenal glands fail. These are internal body chemistry problems that can suddenly become critical.
It's almost overwhelming, the number of ways things can go wrong medically for a pet.
It really is. And that's why this kind of systematic triage approach is so crucial in an emergency setting. Oh, and one other important point the list makes: pain and distress.
Just the pain itself.
Yeah, severe pain is considered an emergency. It needs managing right away, not just for the animal's welfare, obviously, but because intense pain can actually be a sign of a really serious underlying problem.
That makes perfect sense. So this list is comprehensive, gives a great overview, but it's really just the first step, isn't it? The vets still need to do their exam, maybe run tests to figure out the full picture.
Oh, absolutely. The list is like a framework, a guide for that initial super fast assessment. But it's the veterinarian's skill, their examination findings, maybe blood work or x-rays, that really pinpoints what's going on and confirms the level of urgency.
Well, going through this deep dive, looking at all these potential emergencies, it really gives you a much deeper respect for the huge range of health crises our pets can face. It's definitely a strong reminder that even symptoms that seem minor at first could be an early sign of something bigger. Getting professional help quickly is always the smartest move.
Yeah, and maybe the provocative thought here is, how does knowing about this prioritization change how you might look at your own pet? Are there subtle things you might notice now? Little changes in behavior or condition that might make you think, maybe I should get this checked out sooner rather than later. Perhaps exploring some of the conditions we touched on, if any caught your interest, could lead to you being even more proactive about their health down the line.
That's definitely food for thought. It certainly makes you appreciate the emergency veterinary teams even more, the quick thinking, the skill, the compassion they bring to these really tough situations every single day.